We want to provide the very best mental health services for the people of West Sussex. So that means us looking at our accommodation, it means us looking at where services are delivered and how services are delivered.
Some of the wards are old Victorian buildings, so it's very difficult to manage the situations within those buildings and wards. For example, the heating doesn't turn off or doesn't turn on or can only be done in one way. Last winter, the roof was leaking in one of the wards and it was very difficult to get that repaired. What we are doing in this consultation is looking at what is the best method of reorganizing the estate so that we can make sure that our people have a place to go if necessary.
As well as developing centres of excellence for both our patients and our staff, which will make sure that we deliver the very best high quality patient care. We will work really hard to support people to stay at home and not have to have a hospital admission. One of the things that's going to really help us to achieve this is by our developments within our community services, which will mean that we can expand the support that we provide to patients to keep them well, to keep them out of hospital.
As a GP, what I really like about these proposals is that while the estate situation was non-negotiable and needs to be done, and there's clear imperatives on that, what it really allows us to develop is the community services.
National policy is that we move away from having mixed gender wards. So as an outcome of what we're trying to do, that will mean that we will move to having female only or male only wards, which protects people's privacy, dignity and gives them a safer environment to be supported in. One of the things that we do want to make sure though is that we provide some shared space outside of the wards for men and women to mix together and to socialise.
We've got a set of proposals, but we want to hear people's views so we can refine, we can shape and we can develop them, and it really is a two-way conversation. So we've had a number of stakeholder and public events so far where there's been some really good conversation in the room around transport issues, what we might do in terms of solutions, in terms of people's feelings and what they want us, what's important to the people of West Sussex and what they would like to see happen, and all that will be fed into the decision-making process.
Ideas that are contributed by the public can and do change the way services are planned for the future, because ultimately it has to work for the public as much as for the services.